Hey everyone, welcome to the Happy Flosser podcast. My name is Billie. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome back. I am hoping to help you feel more confident, capable, and grounded in the science behind what you do every day. As your host, we are going to dive into a topic that shows up in clinic and didactic, and definitely on your board exams. The bacteria associated with different types of dental caries. That is what we're talking about today. So, if you are a student who is struggling to remember those primary pathogens that are associated with a high caries risk, then this episode is for you. We're going to break down the major bacterial players in caries development and then what types of caries that they're linked to, the level of risk associated with each one of those bacteria, and then hopefully a couple of memory tricks for you to help you recall them in your head. So by the end of this episode, you'll understand not just who these bacteria are, but why they matter and how they show up with real patient care. So let's just get into it. So I know as a student, when you start hearing some of these big long words in caries development and caries risk, it can be really overwhelming. And some of these words are just hard to say. So when they're hard to say and hard to spell, they're hard to remember. So let's see if we can all discuss this together in a way that makes sense and really brings clarity to you. The first one we have to talk about is Streptococcus mutans. That is the big bad boy. So they are the primary initiator of dental caries, especially smooth surface caries. And it's actually the first one that I want you to be able to just bring back in your recall system when you are thinking about dental caries. Streptococcus mutans should be the first one on the scene for you as a memory. If no other bacteria comes to your head, strep mutans should be the one that definitely is your first to remember. So it's powerful because it is highly acidogenic, meaning that it produces acid. It's also highly acidic. What does that mean? It means that it survives in acid. It loves sugar. Love sugar. So think about it. If I can produce acid and then survive in acid, and then I love sugar, I'm going to be a happy camper in the oral cavity of somebody who has a high sugar diet. Like, this is just a great place for me. But the other piece about Streptococcus mutans that is important for you as a dental hygiene student is that it creates sticky glucans that help it stick to the enamel. Not only does it survive and thrive in a sugary, acidic environment, but it's sticky. So just think Streptococcus mutans are sticky so that it sticks to those tooth surfaces. It makes it hard for you to remove it, right? So with our patients, if they're not brushing long enough or adequately, those Streptococcus mutans are going to be the rulers of the mouth. So the risk level for Streptococcus mutans in its caries risk for patients is high. So this is our first attacker, the one that starts the demineralization process. So the Streptococcus mutans, they are the first ones to initiate the whole things. Here's your memory. Your memory trick for strep mutans being the high risk first attackers that are sticky, that love acid, that produce acid, that love sugar. The mutans make the mess. If caries is a crime scene, strep mutans is the one who breaks the window and gets inside first. There's your memory tick. So they're the sticky bandits of the crime. So if you watched Home Alone, the wet bandits, and then in part two of Home Alone, they were the sticky bandits, those two are the Streptococcus mutans. They're the sticky bandits. So they love to get inside the enamel first. The second one is Streptococcus sabrinus. So their role, the Streptococcus sabrinus, their role is to work alongside the Streptococcus mutans to really accelerate the smooth surface caries. And this is important because it's not as common But when the Streptococcus sabrinus is present, it really increases the severity. And it's particularly aggressive in a very high sugar environment. So that puts our patient at a risk level of moderate to high. So it's like Streptococcus mutans, but it's kind of like their sidekick. So it's not always there, but when it is, things escalate. It's kind of like a dynamic duo. The memory trick for Streptococcus sabrinus is think of it as S mutan's sibling who joins in and makes the situation worse. You know how sometimes, well, I'll tell you at my house, when I have one kid over, one friend over, things are still pretty calm and relatively run smooth in my house. But if two friends come over, oh my gosh, things get a little crazy around my house. So Streptococcus sabrinus is the sibling that kind of creates more havoc and is the dynamic duo for Streptococcus mutans. And then the third one for you to kind of keep in mind is Lactobacillus. So Lactobacillus is really associated with caries progression, especially those deep dentinal caries. So what's important for you to know is that um, it doesn't necessarily start the lesion. Lactobacillus is one of those bacteria that it doesn't necessarily start the process, but once the enamel is breached, the lactobacillus kind of thrives in that environment. It loves low pH environments. So you have that patient who's like the constant grazer, they're constantly eating and exposing that mouth to acidic environment. The lactobacillus is going to thrive. It's actually indicative of a high carbohydrate intake. So when somebody has, widespread aggressive decay, and they have a high sugar diet or a frequent small meal diet or high carbohydrate intake, it's typically the best situation for lactobacillus. So the memory trick for lactobacillus, it comes later in the process. So after the enamel is already compromised. So lacto later, right? So you've got strep mutans, those are your those are your sticky bandits. And then you've got your Streptococcus sabrinus. Those are your sidekicks. They really help the Streptococcus mutans. And then you've got your lactobacillus. Those are the later gators, right? They come later in the process of decay. Then we have our root caries bacteria. So these are the pathogens that they really thrive on the root caries situation. They're primary bacteria that are associated with root caries, and they thrive in this area. They kind of like a neutral pH. They're not necessarily the pathogens that thrive in those low pH situations. So they tend to be a little more common in our older adults, patients who have xerostomia, recession present, and definitely a history of periodontal disease. These are the Actinomyces viscosus and Actinomyces nasalundae. And the risk level for these guys, they're not as aggressive as the Streptococcus mutans, but the root surfaces, remember guys, is a lot softer. And so they are a lot more vulnerable to the impact of decay. Although you don't have to have an extremely acidic environment for this stuff to happen, you also don't have to have all of that aggressiveness. So it can happen a lot easier because the root surfaces are softer to begin with. And remember, most of that bacteria, those pathogens, the pellicle formation and then the biofilm accumulation happens at that gingival margin. So if the gingival margin is now sitting on the root surface, which begins as a softer structure to begin with, it's just a lot more vulnerable. So things can have a little more rapid progression, a little easier. So here's your memory trick. Actinomyces acts on the roots. So the word act reminds you that actinomyces. So it acts on those root surface. Hopefully that helps you a little bit on that. And then the next thing I just want to talk about is early childhood caries. So yes, Streptococcus mutans, again, they are the primary pathogen of early childhood caries. We also have a couple of others, the Lactobacillus fermentum and the Scardovia wickesi are also early childhood caries culprits. So they're common in infants and toddlers, often linked to bottle feeding, or caregiver transmission. So this is transmitted specifically from your caregiver, and it thrives with frequent sugar exposure. You'll see a rapid demineralization of the primary enamel. Now, keep in mind, guys, from oral anatomy, that primary teeth demineralize a lot faster. And so the feeding habits often support the bacteria growth. So a memory trick for the early childhood caries is mutans and mommy. So the mutans are often transmitted from the mom or the primary caregiver to the baby. And then the other little category of childhood caries or caries, bacteria associated with caries risk, I should say, is rampant caries, because sometimes you'll see patients and they're really out of control. They have a very high risk level going on. So that's typically when you have the combination of Streptococcus mutans, Lactobacillus, and Scardovia wiggisi. So the rampant caries is usually a team effort between the initiators and the progressors. So it's usually linked to high sugar frequency, xerostomia, substance use, eating disorders, all brought together with poor oral hygiene as well. So a memory trick for you for rampant caries is rapid and reinforced. So the mutans start it and the lactobacillus reinforces it. So hopefully that kind of helps you with that. So if you think about each one of these bacteria, they each kind of have a caries type, a risk level, and a memory trick to them. Hopefully you've seen that kind of as you're listening to this podcast episode. So just kind of as a review, strep mutans are associated with smooth surface caries and early childhood caries. The risk level is high. Mutans make the mess. Streptococcus sobrinus, they are smooth surface caries. The risk level is moderate to high. Sobrinus equals the sibling. Remember, they need to have the sidekick. Lactobacillus, they are the deep dentinal caries. It's a moderate risk level. Lacto, they come later in the process. And then actinomyces, those are our root caries. They have a moderate risk level. And remember, actinomyces acts on the roots. So one of the things that is really challenging as an early clinician or a student is how to take the information, the didactic information, and apply it in the clinical setting. That can be really hard. So I'm going to give you just a couple of little things. I see students really struggle with this, right? Here's the thing is you have to have active recall in the clinical setting. So you have a patient in your chair and you see these things show up, but you're not really sure how to connect the dots there. And if you're not doing saliva testing to actually know exactly what pathogens you're dealing with, sometimes you have to go based on how the patient shows up. What do the radiographs look like? What is their history and what are they showing up? Like how many restorations, interproximal restorations are they showing up with? So there's a lot of ways that you can connect the dots on determining your patient's risk level without actually knowing the specific pathogens that are in the mouth. But actually having that clinical application of theory to practice can be very challenging as an early clinician. So if you've determined based on how the patient presents in the chair, if you're not doing saliva testing, that they probably have Streptococcus mutans in their mouth, you want to focus your attention on their sugar frequency, the type of fluoride exposure that they have, and perhaps recommend some xylitol. If you've made the connection that your patient has a high lactobacillus count in their mouth. Maybe there's some deeper carious lesions that are getting closer to the nerve chamber. You're going to look for those deeper lesions to kind of deduce that. You're probably going to offer some dietary counseling for that patient to be sure that their repeated high carbohydrate sugar intake can be modified. If your patient is presenting in a way that you're suspicious of actinomyces being the culprit, right? So you're evaluating the recession, you've noticed xerostomia, or maybe they're taking a medication, they've got some root surface exposure. You're going to look for ways to modify their home care habits and probably expose those root surfaces to repeated doses of fluoride to really uh, decrease that risk for that patient. And then if you see patterns of early childhood caries, you're going to question the patient and the parents about things like feeding habits and discuss the process of caries transmission from caregiver to patient. So a lot of parents don't realize, they just think it's genetic or hereditary. They don't recognize that they are the transmitters of these pathogens from parent to child. So understanding that bacterial link for the patient and educating your parents and educating your patients on that cross contamination and increased risk as a result goes a long way. Understanding the different bacteria really helps you tailor your patient education and determining a good risk assessment for your patient that's right on the money, where you can then take that information and apply the right types of treatment plan and care plan development for your OHI plan for your patient to really help them mitigate and manage their caries risk. So today we covered those three major bacteria behind different types of dental caries, how they really behave, and how to remember them. These organisms are not just test questions, they're part of real clinical practice that you're going to see every single day. I hope this was helpful for you guys. These are definitely going to be board type questions for you. But also, when you are working with a patient in the clinical setting and you're trying to determine their caries risk, as you are working through school, see if you can't identify, just based on what you see on the radiographs, on the medical history, and in the patient's mouth when you're doing your assessment, if you can't connect the dots on what pathogens you suspect this patient has in their biofilm. I hope this was helpful for you. If you guys are looking for some kind of additional support, I did put a link in the show notes. It's like a 10-question quiz to help you see if you remember this information. All of the recall and active implementation is super helpful for you to really increase your knowledge, awareness, and recall susceptibility. So you have to continually expose yourself to this information and then test your knowledge. Continually test your knowledge. You can also click on that link and then get access to that quiz to see how you did at listening to this episode in a way that you understand it. I hope you guys have a great week. If this was a helpful episode, be sure to share it with your friends. I really appreciate it. Take care.